3 often missed causes of lumbar disc bulges or lumbar disc herniations. Whether you've been diagnosed with an L4-L5 disc bulge or an L5-S1 disc bulge, and if it's been causing you an agonizing amount of pain and limitation, whether it's back pain, buttock pain, leg pain, even numbness or tingling into the feet, or even weakness into the legs and feet, then pay attention to this video, because you're going to learn 3 often missed causes of lumbar disc bulges or lumbar disc herniations, especially at L4-L5 and L5-S1. Hey there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to stabilize and strengthen your back, and also introduce you to corrective chiropractic techniques and methods. Like this, you can bend, move, and lift normally in your life without pain and limitation. And like this, you can enjoy the things you want to do in life. So you want to learn about these tips and strategies, be sure to subscribe right now by tapping on that red button below that says subscribe. Click on the notification bell. Like this, you don't miss out on these weekly video updates. In my practice, I've helped hundreds of people recover from chronic and also very serious spinal conditions that involve not just disc bulges, but also distortions on their spinal alignment, degenerative processes that have caused them pain and limitation and disability in their life. And one of the things that makes us unique and different in our practice is that we do corrective chiropractic care. One of the techniques that I'm certified in is called chiropractic biophysics. And this technique and the training I've received in this technique has allowed me to identify many causes of disc bulges in people that have often been missed. In this video, I want to give you 3 often missed but yet common causes of disc injuries and disc bulges that I've seen in many of my patients, including some of the patients I've seen this week. So one of the biggest mistakes that I've seen that patients find themselves in, and it's no fault of their own if this happens, is they never really had an actual full assessment of their entire spine, the alignment of the spine from the frontal view and from the side view. And I'll tell you why that's important in a moment, because one of the often missed causes of disc bulges and disc injuries in the lower back is spinal misalignment. Spinal misalignment, and not just in the local region of the lower back, but other areas of the spine. So as a corrective care chiropractor, we do full spine analysis on x-rays. And many times I see patients come in with their spine completely distorted in either the coronal alignment, so that would be in this position, or in the sagittal alignment, that would be looking at it from this side. So oftentimes I see patients' spines that are either off center like this, or that's a coronal imbalance. And sometimes I'll see their spines where they're really off center from the side view in the sagittal direction. That's called sagittal balance. So they may have a forward head position, a rounding of the back, a flattening of the lumbar lordosis, an increase of the lumbar lordosis, or any combinations of this. The point is that an often missed condition that causes lower lumbar disc injuries is some form of misalignment, usually a global misalignment along the entire spine, either in 1 or 2 sections or multiple sections, either in the sagittal plane or in the coronal plane. And why that's relevant is this. You can imagine that the spine is designed to take the loads of your body. That's the weight of your body from the effects of gravity. The best way for your spine to be positioned to absorb those loads evenly is when the spine is in its ideal alignment. Ideal alignment from the front is straight. Think of an arrow, it should be straight like an arrow. From the side view actually has normal curves. The neck approximates the shape of a circle, the middle back approximates the shape of an ellipse, and the lower lumbar spine approximates the shape of an ellipse, but in the opposite direction. So these curves, they're perfectly balanced, and they should be one on top of each other. So C1 should be over T1, T1 should be over L1, L1 should be over sacrum. It should be in good balance from the side view, and the head should be over the center of the sacrum between the pelvis from the front view. When this alignment is off balance, let's say like this, which I see this often in our patients as an example. This is just one example, but there are a multitude of examples. Well, check this out. So the person's symptoms and injuries are in the lower lumbar spine, L4, L5, or L5-S1, or anywhere around here, right? And they may have either good or bad alignment in the lumbar spine. They may have only had their lower lumbar spine examined or x-rayed or MRI'd, right? And the disc injury has been identified, but no one ever looked at the entire spine. but we do as corrective care chiropractors. Could you see how this is a bad condition for the lower lumbar spine? Can you see how the person's upper body weight is off the center of mass? Now there's an abnormal load distribution. The weight of the upper body is over space, and it has to compensate down the lower lumbar region, now causing strain and stress, abnormal loads in those lower lumbar discs. And over time, it will cause annular tears and eventually disc bulges. So one of the often missed causes of lower lumbar disc bulge, L4-L5, L5-S1, is some form of spinal alignment, either locally in the lumbar spine or globally throughout the rest of the spine. And this is why you need to have a full spine assessment by any doctor that is focusing on doing full spine assessments. Typically, a corrective care chiropractor, one that's trained in chiropractic biophysics, will do this. And watch right to the end, because I'll show you how to find a corrective care chiropractor in your area through a directory that I can refer you to. Now, number 2, which is an often missed cause of lumbar disc bulge or lumbar disc herniation, like L4-L5 disc bulge or L5-S1 disc bulge, is what's called an instability. There are different types of instabilities, but some of the common ones that we see are either an anterior listhesis or a retrolisthesis. What that means is this. So you remember the alignment of the spine I showed full, right? I'm going to show you some actual segments of the spine, okay? So we know that the spine should be straight from the front and then have a curvature from the side, okay? Depending on the part of the spine, the curves are shaped differently and curve in different directions. So we also know that the actual spine, all the vertebral bodies should be continuous and should not be disrupted in their alignment from front to back or even side to side. However, we often find that there's sometimes a slippage of the vertebra. So take a look there. The vertebra is slipping forward. That's called an anterior listhesis. Sometimes it slips backwards. That's called a retrolisthesis. Now, I'm accentuating the movement so you can see it visually. This can be anywhere from a few millimeters, 2, 3, 4 millimeters, sometimes more. In the lumbar spine, when it's more than 4.5 millimeters, it's certainly going to relate to an instability. In the cervical spine, when it's more than 3.5 millimeters of slippage, that also relates to instability. Nonetheless, even if it's a few millimeters of slippage forward or backwards, guess what's happening to the actual fibers of the disc? They're being strained and they're being injured. So there's a slippage backwards, retrolisthesis, or slippage forward, anterior listhesis, that is shearing those disc fibers, injuring them. Just that alone causes pain and inflammation and associated symptoms like nerve pain and either local back pain, muscle spasm, or even shooting pain down the leg because it irritates the nerves and stretching the nerves. However, over time, do you think that that injured disc will maintain its integrity or eventually become injured and bulged? Of course, it will become injured and bulged. Couple that with an abnormal alignment of the spine and degenerative processes, then you have a recipe for disc injuries and one of the often missed causes of disc bulges. Again, the only way to see these really well in the weight-bearing position, which means you're standing on your feet, so you see what the effects of gravity and load is doing on your spine, is with an erect standing x-rays. And you also want to do a full spine x-rays. Like this, you can correlate the alignment of the cervical spine, the thoracic spine, with the lumbar spine in the coronal and sagittal plane to make sure to see what's happening with that alignment and how it relates to any anterior or retrolisthesis, and of course to determine how to correct it. Now, the third often missed cause of a lumbar disc herniation or a lumbar disc bulge, especially at L4-L5 or L5-S1, is an unleveling of the sacral base, either due to a malformed sacral base or because of anatomical leg length differences or anatomical leg length inequality. What does that mean? Let me show you with another model, okay? So now in this model, I have the lumbar spine, the pelvis, the sacrum, and the top part of the femurs, okay? The hip joint areas. So the sacrum or the sacral base should be level, parallel to the ground. Ideally, both the legs, your femurs and tibia, should be equal size. Now, there is variation in the length of the femurs and tibias in many people, sometimes by a few millimeters. However, in some cases, people may have a short leg anatomically, more than 5 millimeters, and at that point, that can cause an imbalance of how the person is standing. So if they have a short leg on one side, it will cause an imbalance, and now the pelvis tilts, the sacrum tilts. What happens with the lumbar spine? It also tilts, okay? Couple that with a malformation of the actual sacral base, which is common sometimes, right? So maybe the sacral base didn't develop level, it developed on a slant. So you can have an anatomical short leg, you can have an obliquity with that sacral base, and there's gonna be more load on one side of the sacrum, okay, on this side. I'll show you on the other side in a moment. On this side, which means it can injure those discs and cause disc bulge. We see this all the time. So again, from this side, okay? So if there's a left short leg or an imbalance or unleveling of the sacral base, that can cause that obliquity of the pelvis and sacrum. And you can see over here how the disc is now being compressed on one side, causing injury to those annular fibers and eventually causing it to bulge. And that can most likely irritate the L5-S1 disc, causing an L5-S1 disc. Remember, the spine is continuous, which means it can affect also the L4-L5 disc. Now, couple that with degeneration and degenerative processes, degenerative disc degeneration, also spinal misalignments, retrolisthesis, anterolisthesis. We catch these on x-rays. Not everyone's going to have all of that. Some people do, but any one of those can actually cause disc bulges in the lumbar spine. And that's why it's important to, when you get assessed, to not just look at, have a physical examination of your back and have a neurologic examination and not just an MRI, but you need an x-ray evaluation. Again, not just the lumbar spine, but also of the sacrum, the pelvis. You want to see the leg lengths and the rest of the spine, the thoracics and the cervical spine as well. So now I'm going to talk about the solutions for each one of those causes. So cause number one was spinal misalignments. Well, when there's global spinal misalignments, we want to apply corrective care techniques. Part of that is going to be postural restoration with postural adjustments and postural exercises. And another part of that is going to be spinal tractioning techniques. What that does is it helps to restore the normal alignment of the spine, get it as good as possible, as close as possible to normal, or as best correction as we can, reducing the misalignment, therefore improving the load distribution on the spine, now reducing the stress on the discs, giving it a chance to actually heal, and in doing so, people's symptoms and disability improve. I've had many people go through corrective chiropractic care in my office with these techniques, and one of the main techniques I use is called chiropractic biophysics, and they've done really, really well. The same techniques can be applied to instabilities as long as there's an indication to apply these techniques and there's no contraindication. So that means that the actual treatment and corrective care techniques have to fit the person based on their condition and what we see on their x-rays, and make sure it fits according to their instabilities. And the third thing is, how do we address this unleveling of the pelvis or the leg length inequality? Well, when indicated, and of course it's going to depend on the person's evaluation, we provide a heel lift in the person's shoe. And what this heel lift is, if you look closely here, one part is tapered down, it goes towards the front. Over here is thicker, and there's different millimeters or different heights. It could be 6 millimeters, 8 millimeters, 10 millimeters, 12, sometimes more, it depends. But when it's more than 10 or 12 millimeters, we can't put a lift in their shoe. We have to actually get their shoe built out from the outside, which we've done with several patients. But these lifts, when they're applied into the shoe, 10 millimeters or under, now will help balance that leg length inequality, right? Push that up and get that sacral base balanced. The goal of the lift is not to improve the leg length equality. We're using that as an actual lever to push the actual pelvis into proper position. The goal is to stabilize and level off the sacrum, because the spine sits in the sacrum and the disc between L5 and sacrum is right there. So we want to improve that leveling. And I've applied and given these lifts to hundreds of our patients with sciatica, with disc bulges, with back pain, with leg pain, and many, many people did extremely well, improved their symptomatology, improved their sacral balance, and just did amazing with these corrective techniques, and also a simple lift just like this. I can't tell you how many times I've had patients come to my office and they've tried all sorts of therapies. They've tried physiotherapy, they've tried massage therapy, they've tried acupuncture, they've done yoga, they did home exercises, they've done medications, prescription over the counter, they've done injections, they've had surgical consultations with specialists, they've done MRIs, another MRI, nerve conduction tests. 1, 2 years later, they still have the same problem, same condition. I'm not saying those treatments and diagnostic tests are bad. No, they're actually very good. However, maybe the timing of when they were used was off. And one of the most common things that I've seen one of the most common mistakes, and it's not the patient's fault, it's no fault of the patient because they're just being led the way they're being led, is that they never really had a full spine analysis or a full spine correction. So when you get the spine analyzed properly, especially with x-rays, when you get it corrected properly with correct techniques, they improve. And I've had many patients that have come to my office after they tried those therapies and did really well with corrective chiropractic techniques. So my message for you is do not lose hope. Do not lose hope. Your body has an ability to heal when it's supported properly. And perhaps what's missing is corrective chiropractic care. If you're looking for a corrective care chiropractor in your area, I can help you find one, hopefully in your area if you're in Canada or United States, by going to a certain directory. If you want the directory, please do comment below in the comment section below, and I'll just type it out for you. And you go to the directory, plug in your town, your zip code or postal code, and hopefully you can find someone in your area. There's many throughout the United States. There's some in Canada, some in Europe. Hopefully you can find someone close to you. Now, if you want to continue your learning about the anatomy of a disc bulge, why they're so painful, and some exercise to actually help with that at home, check out this video right here to continue your learning on my channel.